right now. All right. I love this part of the day, man. We get to talk about some specific topics, and we get away from I guess, some more contentious things that are going on. Hey, everybody, I'm Jim Dedelow, host of Jed in the Region here on WJOB. We're in the Community Programming Initiative portion of what we do here on WJOB. And if you want to be part of it, all you got to do is email me at jed@wjob1230.com. And that guy right there looks very much like a doctor. How you doing, doctor?
I'm good. How are you?
All right. All right. You say your name so I say it correctly for the rest of the show.
No, you said it right. It's Demetrios Karamichos.
Where are you from?
I was born and raised on the north side of Chicago.
And that would be in the north suburbs or
No,
on the north side?
No, north side for real. Foster in California.
Foster in California. So what'd you do? Like go to Lane Tech or something like that?
Close. I went to Loyola Academy.
Oh, same idea. Gosh. You know, it's weird. I traded at the Board of Trade for all those years, and the Loyola Academy guys seemed to have forged some sort of close relationship when they were freshmen, and they still had it into their 40s and their 30s and 40s and into their 50s. It's a very close-knit bunch that comes out of there, fair to say?
Yeah, most of my friends in the area, we ended up going to Loyola too, so we pretty much ended up hanging out together.
Oh, nobody wanted to go to Lane Tech or to any of the public schools up there?
No, I would have gotten chewed up and spit out if I went to a public high school there.
So you then went to what undergrad?
I went to the University of Illinois in Champaign for 4 years, and then the University of Illinois in Chicago for med school.
And then, so you went to UIC downtown.
Correct.
You have some fun down there?
You know, I got mugged once, so not really, but overall it was a good experience.
Where'd you get mugged?
On Roosevelt.
And what?
I think it was like Racine.
Oh, so right there by the south of the hospital near, what's that big St. Ignatius?
Yeah, I had the genius idea of going for Kentucky Fried Chicken at night. So,
could you do me one quick favor and turn that mic just a little bit closer towards your face? There you go, right there. That looks good, right there. I know it seems like it's in the way. You know, I used to live on Taylor Street, and I would ride my bike at nighttime, and that was in the late 1980s. And in a weird way, it was, I guess maybe slummier. I don't know if that's the word, but it was, you know. Driving out to the stadium on Madison was late women of the night and you know, drug salespersons, and now it's all yuppified. But it seems like it would be even more dangerous to ride the bike around at 11 o'clock now versus then, even though it's been all yuppified in the area.
Yeah, well, I learned my lesson then.
Yes. Doctor, you then went to grad school. What are you doing here in the region now? What is Region Vein?
So Region Vein is my new practice. I've actually been in the region for many years treating veins. I moved here in 2007 to work for one of the largest vein providers in the country. I built a practice up over the years, but as of the beginning of this year, I decided to separate and start my own practice for myself.
Oh, so you're going off on your own?
Yeah.
So, do you have any business background?
Well, I'm learning on the fly. I have a good team, so I've had a lot of support from that standpoint. But I'm good at what I do, and I know what I'm not good at. So I've basically I have a team that I'm very satisfied with that's working on the business side of stuff.
All right, so I know you'll leave some people out, but give us an idea of some people on that team that you turn and you trust.
Well, for starters, my wife is heavily involved. She's involved in the accounts receivable. In terms of the business side, I've working with Indiana vein specialists who are based out of Carmel. So they're involved in pretty much anything non-medical.
And then do you have you got any medical assistants or any nurses?
I have a good team. I brought two of my favorite employees, well, I'll call them teammates, that I've been working with for the last 10 years. Gail Brown is my ultrasound tech. Ultrasound is pretty much the key to the diagnosis and treatment of most of our cases. So Gail's been with me since I started here. So for the 13 years that I've been here, she's been with me, and she followed me to my new practice. So I'm humbled and excited that she decided to follow me. Roseanne Becerra is my office manager. She's been with me for 10 years, and I brought her along to be my office manager. So right now we're small, we're lean and mean, but hoping to grow.
Did Dave Kuziak harangue you on the way out? I told him not to.
Yeah, a little bit, but no, he's fine. I reassured him.
I said you can't show it to him. Just go in his office and pay the copay or
no,
whatever.
People do that all the time.
Yeah, all right. Hey, we're talking to Dr. Demetrios Karamichos. He is at 931 Ridge Road. He has joined the Community Programming Initiative team here, and we're going to get to know him and what he does here. All right, so 931 Ridge Road, is that right by Town Hall?
Yeah, it's right across from Town Hall.
Right across from Town Hall in those kind of nice brick and those things. So kind of on the backside of the Hallmark store.
Right behind the Hallmark store, exactly.
All right, so you went on your own, which is a risky venture, and you're going into service people, and you obviously got to get financing and all of that stuff. So let's go into some of the more technical stuff. What service do you provide?
So I am a specialist in vein disease. So the majority of our patients are varicose and spider veins. And in terms of, the kind of patients I see and the kind of symptoms that these veins can cause, it's basically pain in the legs, aching, swelling, cramping, restlessness, easy fatigue. These are the kind of symptoms that patients present with in the office. And these are usually symptoms that progress over time. It's not like they show up over a week or two. These are symptoms that slowly get worse over months and years.
So you said a spider vein and a varicose vein. To the non-vein specialist, what the hell is the difference?
Well, for the most part, not much. Really, the difference is the size. So our legs have veins that are small. Our legs have veins that are big. So when a small vein goes bad, it's a spider vein, and it looks the way it looks. When a larger vein goes bad, it's called a varicose vein, and they're the bigger, ropier ones that you'd see on a person's leg.
All right, who gets these?
Everybody. Mostly women, but men get it too. It's estimated that maybe 55% of the population have some degree of vein disease. Maybe about 45% of men have some form of vein disease. So this condition is primarily genetic. There's a lot of misinformation, a lot of myths when it comes to varicose veins, but it's primarily genetic.
They hurt?
They can hurt, they can ache, they can cause the skin to itch. In some more severe cases, they can even damage the skin to the point where the skin starts to break down and people can get ulcers and the veins can bleed. So in a smaller percentage of cases, it's more severe.
What is endovenous radiofrequency ablation?
That is the name of the procedure that we use to treat the largest of the varicose veins. And these are veins that are typically below the surface. So the biggest of the veins are below the surface, and radiofrequency ablation is basically the use of heat to damage the vein to the point where the vein scars and hardens, and the body then eventually reabsorbs it away.
And that is that inpatient or outpatient? Or
No, all of these procedures are done in my office. They're done under local anesthesia, so people are able to drive themselves in, drive themselves out. There's no sedation required. There's no special instructions afterwards. Everything is done in the office, and they can resume their activities right away.
All right, so let's go through the whole through the gamut here. By the way, if you guys want to talk to Dr. Demetrios, Karamichos, 219-845-1100. You got a question about a vein or a procedure or how things work or what it's like to go from having everybody else deal with business stuff to having to deal with it yourself, all you got to do is call us at 219-845-1100. All right, I've heard this. I've heard this before. I don't know that much about it, but ultrasound mapping and who does it and why do you do it and that kind of stuff.
So that's Gail in my office. So ultrasound is the diagnostic modality. So when someone presents with symptoms, in terms of what I do, there's the physical exam, so I examine their legs, but ultrasound is used to examine the veins below the surface. And for many people, most of their varicose veins are below the surface. So ultrasound mapping is pretty much what it sounds like. We map out the abnormal veins using ultrasound.
All right, so you leave the big firm and you come and you're going to own you open your own one and own it and stuff. Mm-hmm. So the advantages to the patient of that?
Well, the advantages is when they call, they're not going to talk to an operator, they're not going to talk to a customer service person, they're not going to get forwarded to a call center that's in Illinois. When they call, they're going to speak to either one or two people that are in the office that are literally maybe 20 feet away from me.
And so, I mean, that's not the norm these days,
no.
Just so you know. I mean, that's kind of I guess one of the knocks against healthcare in general, that it has gotten very bureaucratic. So to some extent, you're going almost, you're kind of like us, I guess, in a weird way, like just a small person. You're going to come to the door, I'm going to answer it, that kind of stuff.
Yeah, right now there's only 3 people in the office. The other thing I can add is, in many cases nowadays, patients are funneled to a nurse practitioner or a physician assistant for treatment, and I can say that when a patient comes into the office, they're going to see me and nobody else.
All right, so I have a relative who regularly gets Botox for migraines, and when she was in another city, she wound up going to a varicose vein clinic for that, which I thought was very odd. Is that something that you guys are going to do?
No, and that's one thing I'd wanted to highlight for the listeners is there's a lot of places out there that treat veins on the side. So they do this, they do this, they do this, and they also want to treat veins. So the answer to your question is no, I have no intention of doing anything else other than doing what I do best.
All right, so you go to University of Illinois downstate, and then you come up to Chicago and you go to UIC. Mm-hmm. At some point, you got to choose veins. Why?
Well, I didn't start out doing veins. For starters, there is no residency program for varicose veins, and in fact, the training for veins in med school was pretty much maybe 5 minutes in total, so there was really no time spent on veins. The treatments for veins in the past were pretty much limited to just surgery, just stripping, just ripping them out. So, but I actually started in family practice, so that was my original specialty, was family practice. I was in practice from 97 to 2007 up in the north suburbs in Libertyville, and there came a time where I became frustrated with the specialty, frustrated with, insurance, and decided to make the switch to varicose veins.
So you decided to specialize. I got to follow up. What kind of frustrations with insurance are you talking about?
Well, it's things like I can't order a stress test on a patient unless they have a particular diagnosis. I can't order an EKG on a patient unless they have a particular diagnosis. And believe it or not, chest pain is not an adequate reason to order a stress test on a patient.
So, typically, I do these, I do, this stuff with a lot of different doctors over time, and medical and hospital administrators and that kind of stuff. So I try to get an idea of the specialty or the area of medicine, but also kind of how it fits in to the whole, treatment for the individual. Because there's a lot of people listening right now that have varicose veins.
I'm sure.
So I'm just a little curious. How come my brother's doing a residency right now in, what is it, when you're dealing with people that are kind of end of life issues, and sometimes a lot of times they're older, and I can't think of the name.
Hospice?
No, it's hospice is part of it, but there's a palliative care. Okay. And I'm like, gosh, man, when is that? And he goes, man, you would not believe how many places offer that now. They've come up and they've developed palliative care parts of their hospitals. None of these med schools and stuff are like special. I mean, has a specialized program in veins.
True.
I mean, that's just not, it hasn't happened yet.
No.
Will it happen?
Our specialty body is working on it. They're trying to establish residency programs for afterwards, for after medical school. But no, it's been slow, to say the least. So with that, pretty much most of the doctors who do treat varicose veins started off doing something else. So the vast majority of my peers started off life in internal medicine or surgery or believe it or not, emergency medicine. So most physicians started off doing something else before they moved into veins.
Okay, what is thrombophlebitis? Did I say that right?
Yeah.
You want me to say that backwards? Citibelp ab mort.
All right, thanks, Harry Carey. Thrombophlebitis is a condition where the varicose itself becomes inflamed and a clot forms inside of it. So the vein can be hard, tender, painful, red, swollen. That is thrombophlebitis, which is a side effect of having varicose veins.
And you can treat that how?
Well, thrombophlebitis, generally not much. Usually it's time. Compression can be helpful, anti-inflammatories, ice packs, things like that. And then eventually treating the underlying cause, which is the varicose veins that a person probably has.
Nice Chicago sports reference. You did grow up on the north side.
Yeah.
Does that mean that you're a Cubs fan or Sox fan?
I am Cubs fan.
I mean, tried and true. I mean, like,
yeah.
I wouldn't go south. I wouldn't go to, 35th and Shields or whatever that is. You wouldn't go there?
You know what? I've been to Comiskey Park. I remember when I was a kid, they'd give away free Sox tickets in school if you read a book or if you had perfect attendance. So I did end up going to Comiskey Park, but it's because I got free tickets.
So you just looked at a varicose vein on a guy that hopefully he'll come to your office still, because he's a guy that says a good day is when the Sox win and the Cubs lose. So you present the flip side of that, basically.
That's right. I take care of Sox fans. I even take care of Packer fans.
Now you're stretching it. We're talking to Demetrios. Let me get my phonetic spelling out here. Karamichos. How do you like being in the region?
Oh, I love it. We've been here since 2007. The kids grew up here. So yeah,
what
they
town?
went Munster.
They grew up in Munster,
Yeah.
and now if they moved on or what?
Yeah, my daughter graduated from IU, and she's in Carmel. My son is a senior at Purdue, so Purdue in Westlaw.
And how is that? How is he going to in-person classes, or some of them are not in person, or how's that?
Yeah, that's pretty much it. I think the kids have the option to do online or in person, and he's trying to do in person as much as possible. But
and he's studying what?
Computer engineering.
Oh yeah, you could do a lot of that. I talked to a guy I do some work with on my app, Shamari Walker. He's in his room all the time because he's like, I would like to go to class, but a lot of the professors don't want to go into class, so I'm looking at Zooms on them. So so what is the ultimate aim? You moved into the community. You have opened up your vein institute or clinic, I guess clinic, right?
It's a clinic,
Yeah.
a practice.
Yeah, vein
Sure.
practice right in the middle of town.
Mhm.
How do you want to see this play out?
Well, basically, I want to be able to retire from there when I'm done practicing. So I enjoy what I do. I really don't consider it work. Um, I love the patients. I love my coworkers. So yeah, I love what I do. The hours fly by, and the next thing I know, I'm driving home. Um, but no, I'm happy with what I do, and I'll continue doing it until I don't want to do it anymore.
All right, so let's follow this chronology, okay? Somebody like Kuziak, let's just use him. He said we could. All right, he's like, hey man, he showed me this vein the other day, and I'm like, this is the weirdest thing, but there's a vein guy coming in, so I think he was kind of looking forward to getting that. So I'm going to ask you to talk for about a minute while I open the door for the next guy there. But follow us the chronology. Typically, let's use a man, okay, like Kuziak. It's getting bigger. He typically doesn't do anything, and then it starts to hurt a little bit. He comes to the office. What happens? What kind of tests and what happens there? So I need a minute to open the door.
Sure.
So go ahead.
Well, after getting some information on the history of the symptoms, as most doctors would do, and a physical exam of the legs, we would proceed with getting an ultrasound of the veins, because, as I said, most of the larger varicose veins that a person has is below the surface. So in order to come up with an individualized treatment plan for that patient, ultrasound is important so that we can map out the extent of what someone has going on below the surface. So ultrasound is done in the office. It takes approximately about a half an hour per leg, depending on the complexity of the problem. And then after the ultrasound is when then I can go into more detail with the patient to tell them what they have, what they got going on, how to treat what they got. And then I can go into more detail in regards to the actual treatment protocol for them.
Anybody ever come in and you have to refer them to the hospital?
No.
No, it's usually either cosmetic or some sort of pain relief for it.
Well, yeah, the vast majority of our patients are medical in the sense that they have symptoms and it's covered by insurance. And that's another, we'll say, misconception about veins is many people think, oh, it's all cosmetic, my insurance will never pay for it. But the reality is that pretty much most, if not all, insurance covers varicose veins, including Medicare. And really the only veins that would be considered cosmetic is if someone walks in and they have absolutely no symptoms at all.
We're talking to Dr. Demetrios Karamichos. He's right there by the Munster Town Hall. It just opened up. Anybody's got varicose veins, that's where you need to go. Doctor, let's finish on this part of it. We're in the middle of COVID pandemic. How does that change what you do?
Really not much. It's pretty much masks. So patients walk in with masks. I see them with a mask, and my ultrasound tech has a mask. But other than that, we're not crazy busy that we have a waiting room full of patients. There's one patient in the waiting room, one patient in the back being treated. So no, it's really hasn't impacted us other than the fact that there's perhaps patients who are scared to go out and seek care. But other than that, we obviously clean everything all the time and offer masks to our patients.
He is Dr. Demetrios Karamichos. Thanks for joining the Community Programming Initiative. You got about 30 seconds. What do you want to tell people?
Well, there's a lot of myths. I would encourage listeners to go to the website to learn about veins, and the website is regionvein.com. I've been in the area for many years. I have many physicians referring to me over the years, so even though the name Region Vein itself is new, the name Demetrios Karamichos is not new in the area. So,
and I won't spell that for you. That is regionvein.com, and the phone number is 595-3095, or you could do 888 leg vein. All right. Hey, thanks a lot. Sit still for a second, and I will end this video, guys. Thanks a lot. We're going to go into the school city of Hammond next, so just stay where you're at. There you go, and we'll do that.